Brenna Gibbons, there has been multiple confirmed measles cases less than 200 miles from Abilene. Should we be worried about this with it being so close to home? I spoke with an infectious disease physician about this to see what he thinks.
All infections, and particularly easily transmissible infections like the measles virus, can kind of migrate through borders and have a risk of becoming outbreaks, over different periods of time. There's not really a great way of knowing for sure if the outbreak will stay relatively contained in West Texas, or if we'll have some cases that end up spreading to Abilene.
According to the CDC, measles was declared eliminated in the United States in 2000, but now we are starting to see it again 25 years later. Dr. Beard says that previously the vaccination rate was higher, but recently there has been a slight decline in those numbers.
We think as a result of that kind of waning immunization rates, that herd immunity has also decreased some and has allowed for new cases to emerge.
He says that the patients who may be at the highest risk for measles are the ones who are too young to receive the vaccine, those who were never vaccinated for it previously, and patients who have some level of immunosuppression.
They would probably end up developing high-grade fever, like a fever of around 105, as well as drainage from the eyes, drainage from the nose, and cough.
After the initial symptoms, around day 4 of infection, Dr. Beard says that patients will start seeing what is known as the classic measles rash, starting around the hairline and receding downward.
There is a booster shot, but most patients will get the booster shot as part of the normal vaccine series. It's most often given to patients as they turn 1 year old, and then at their 4-year-old follow-up with their pediatrician.
Dr. Beard says that if you do contract the measles, there is no antiviral medication for it. The main way to get rid of it is just time and staying well hydrated.